and it's so hard, especially for somebody that is, but it's just such an emotional thing, having to. So I've gone back and forth all day long today, deciding whether or not I was going to film this. At this point, I'm going to go ahead and film it. I don't know if it's ever going to be posted, but I wanted to have it just in case. In my previous videos, I've mentioned, these medical conditions that I have, and never really went into detail. And that's because I have been working on kind of an intro video for my channel that's gonna explain everything. That's a video that I have tried to do on multiple occasions now, but it's just such an emotional thing, having to talk about it and kind of relive the past 2 years, that I get like this, where it just gets to be too much and I have to kind of shut it down. But that's not the point of this video. The point of this video is I feel like my body's either getting ready to go into a full-fledged flare-up, or I'm in a flare-up. I'm not sure yet. The past few days have been extremely rough for me, physically, and then emotionally because of how I feel physically. And I haven't been in a flare-up. I haven't felt like this in a really long time. I mean, it's been at least 7 or 8 months. And then even then, that last flare-up I had the 7 or 8 months ago, it was very short-lived. It was like maybe a couple of days where I felt kind of off and, didn't feel the best. But the way that I felt the past few days, it's definitely reminiscent of the period in my medical journey where I don't want to say that I was bedbound, because clearly I'm not bedbound, but I have been experiencing a lot of symptoms the past couple of days, and so I wanted to do this video mainly for people that are also suffering with Tarlov-Cyst disease. In the intro video that I just spoke about, that I have been wanting to do, kind of explaining my entire medical journey, one thing I want to stress in that video is that at some point along my journey, I decided that I was going to go 100% natural. Any doctor, and I have seen countless doctors over the past 2 years, anything that they have told me, I don't have faith in them, and I don't trust them. And when I leave every single doctor's appointment, every single specialty department you could think of, and then getting second opinions at those departments, and every single one of them, I find there's a huge problem with the fact that all they want to do is, here, take this medication, here, try this prescription, oh, this should work for you. They just want to shove pills down your throat. And so at one point in my journey, I was like, you know what? F you. I don't want to take any more of this crap that you're giving me. It's making me feel worse, and I'm going to follow my own path. So the point of this video was that because I feel like I am getting ready to, go into a full-fledged flare-up, or maybe this is my flare-up, I'm not sure yet, but I am going to be changing my supplement and, kind of my daily routine up just a little bit to either stop it or reduce the severity of this flare-up. So as of right now, for the past couple of days, The symptoms that I've been experiencing are urinary retention. I'm getting kidney pain from the urinary retention. I have extreme burning in my spine, specifically in my sacral area, which is where my cysts are. In addition to that, when I spend too much time either sitting or laying down on one side, whatever side that the majority of my weight is on, it'll go completely numb. We've suspected for the past few months since my last rheumatology appointment that she's fairly certain that I have fibromyalgia. So we've kind of been preparing for that diagnosis. I see rheumatology again next month, and that's when she's going to determine. I'm going to check my blood work again, and if all is the same, then we're more than likely going to be diagnosed with fibro. So when these recent, pain and symptoms started the past few days, it's like a domino effect. So it starts in my lower back where my cysts are, and then it will go into my kidney and my bladder, and I'll get the numbness and tingling kind of shooting down my leg. Maybe not shooting, it doesn't shoot. For me, it doesn't shoot. For some people with this disease, it does shoot, and they have a lot of like sciatic pain. Mine isn't like that. Mine's just more of like a radiating, like a buzzing, tingling kind of thing. And so that will start, and then because of my broken ankle, it seems like all of my back symptoms are making my ankle feel even worse. So my ankle pain right now is just as severe as my back pain. So those two things combined, in addition to the kidney and the bladder stuff I have going on, it's also triggered my C-spine. And in my C-spine, I have 4 or 5 levels. I can't remember how many levels are on your C-spine. I want to say there's like 7 or 8. So I have like stuff going on in 5 of them. So 4 of them, all 5 of them I have bone spurs. And then in one of them I actually have a bulged disc. So I hadn't felt this stuff going on in my C-spine in a really long time. Like I had treated it holistically and did all of these natural things to help alleviate the pain and symptoms, but for some reason, I'm guessing that if I do have fibro, that it has kind of triggered that again in my C-spine. So I have that going on, and then just extreme fatigue. For those that know me, for those that are close to me and they see me every day, I am like an Energizer bunny. I am go, go, go. My mind is constantly thinking, and I'm nonstop all the time. So for me to be on the couch, in bed, and really not wanting to function and not wanting to, life, there's something wrong. For right now, today was the first day I really took it easy. Took it really easy. I've been laying down all day. I've barely been upright. And it's so hard, especially for somebody that is as active as I am, and then who has been doing so well for such a long, chunk of time now. It knocks you on your ass. It just like sucks the wind out of you, and it sucks the life out of you. And I kept telling my sisters and my family that whenever anyone would ask, how are you feeling? How are you feeling? I'm like, God, I feel great. I feel great. But in the back of my mind, I always knew that, the other shoe would drop. And clearly it has the past couple of days. So again, I'm going to be changing up my supplements and stuff, and I wanted to share what I was doing. Again, I am 100% natural. I treat everything in my body holistically for the pain and symptoms for all of my medical conditions. And so today I just wanted to go over the changes that I'm going to be making, the additions I'm going to have, and things that I'm going to take out. So that was a very long introduction, and if you are still here with me, I appreciate it. And I'm going to be praying and hoping for things to turn around. And I will cross my fingers that this is not going to be a full-blown flare-up, especially one that lasts, 2-3 weeks up to a couple of months. The first few that I were in were like 3 or 4 months straight of feeling like this. I'll go ahead and share all of that with you. Hopefully some Charles-Cystic disease patients can find something useful in here for them to take away. All right, so on with my changes.
The first products that I've brought back are my cannabis products, CBD and THC-A oils, as well as a topical ointment. CBD is known for its anti-inflammatory effects, as well as helping symptoms of anxiety and depression. THC-A is a compound found within the cannabis plant. It's known for its anti-inflammatory properties, as well as its neuroprotective properties in treating neurodegenerative diseases. This is a topical balm that I use on my skin, any place that I'm feeling pain. So right now I'm using it on my lower back as well as my neck and my ankle. Please note that these are all products that are non-psychoactive. They do not produce any type of high effect. CBD is actually legal in all 50 states. Lion's mane. This is a rare and edible medicinal mushroom that's used widely in Vietnam, China, and Japan. Recent studies have shown that it's helpful in stimulating the production of something called nerve growth factor within the central nervous system. More importantly though, for my spinal disease, where the dysfunction lies within the myelin sheath that surrounds the nerves, lion's mane has shown promise for the growth, regulation, and the stimulation during the myelination process. One herb that I take fairly regularly already is boswellia. This is a tremendous natural anti-inflammatory. It's actually what I use to replace Advil or Tylenol. Due to the chemical makeup of boswellia, it actually interferes with the cytokine process that actually raises the inflammatory response in the body. 5-HTP is something I only recently started taking just a few months ago, but I absolutely swear by it. For anyone suffering from dysregulated circadian rhythms, insomnia, mood disorders, migraines, anxiety, or even fibromyalgia, 5-HTP can help balance out serotonin levels in the brain and the central nervous system. Holy basil and ashwagandha, both of these are considered adaptogens, which basically means that they help the body deal with stress. I don't think people living with chronic conditions realize how much of an effect being in constant pain has on their adrenal glands. Our adrenal glands are responsible for producing a variety of hormones, specifically cortisol. This is our body's stress hormone. These hormones help the body control blood sugar, burn protein and fat, regulate blood pressure, and more importantly for chronic illness sufferers, react to stressors like illness and injury. Both ashwagandha and holy basil can help support your adrenals and promote health throughout the entire body. Aside from these supplements and herbs, the only other thing that I want to mention right now is movement. I don't think that people understand how important movement is for the body. It's extremely important to keep our bones and our muscles healthy, and the last thing you want to do is lay stagnant and allow your body to atrophy. So for right now, lifting and any strenuous exercise is going to be out for me, but I will not be skipping either of my 2 10-minute walks that I take every single day. All the products that I've mentioned in this video, I'm going to go ahead and link those in the description box below. Otherwise, that wraps up today's video. Thank you so much for watching.